Welcome to Get the Facts. I am Suzanne Bernier Robinson. Today we're going to learn about Derry's initiative to be a heart-safe community. My guest is Chuck Hemian, Director of Emergency Medical Services. Welcome, Chuck.
Thank you, Sue. Thanks for having me.
So tell me, what is a heart-safe community?
Well, a heart-safe community is we have an initiative here in town to improve the survival of out-of-hospital cardiac arrest. We looked back in 2007, and we were looking at our survival rates, and they weren't as great as I anticipated, and I thought we could do better. Unfortunately, we've realized that you have a very short window of opportunity to save the victim of sudden cardiac arrest, and we've determined that CPR is critical to the outcome. So we brought together the police department, the fire department, we brought in the Heart Association. We looked at what steps were necessary. We established some goals so that we could become a heart-safe community. And what that means to me is that we have training provided to our, whether they're businesses, organizations, or residents of the town of Derry. We offer that training on a monthly basis, free of charge. And if you were to go to American Heart Association Training Center, you may pay $50 for that certification. And we're so passionate about that, we offer it at no cost to the community. And that affords anyone the opportunity who wants a training to receive that training. So we look at placing AEDs throughout the community and ensure that we have what we consider to be a real strong chain of survival. And that involves a 911 system, early CPR, early defibrillation with our AEDs, and early advanced care for my paramedics.
So it started in 2007. It sounded like you've got a lot of different departments on board as a joint effort to really make this work. What percentage of the community is certified now as a...
My goal is to have around 25% of the community trained, and we're probably around 15%. We do 15 to 20 people per month coming into our classes. We go out and do some on-site training as well. Our goal is to get as many people trained as possible. And the more people that we train, the more public access defibrillators that we have, it certainly will improve our survival rates.
So let's really start with why this is so important. They're used during cardiac arrest.
Correct.
And not heart attacks,
Correct.
right? So can you explain what the difference is between the two?
Well, when you come into our training program, you're going to learn the difference between a heart attack and a cardiac arrest. And we look at cardiac arrest. In the Derry area, we have approximately 60 per year cardiac arrests. That means that 60 people have a sudden cardiac arrest. By definition, they're clinically dead. And we want to train people to be able to do CPR and to deploy an AED, which gives them the best opportunity at survival. And we've learned you have a very short window, 4 to 6 minutes, and if you don't act within that time frame, less than desirable outcomes happen. And our goal is to improve survival.
So with a cardiac arrest, what kind of symptoms would someone experience?
Well, a cardiac arrest typically is an electrical abnormal rhythm that occurs in your heart, and we know that it can occur in man, woman, or child. We really see it in the older population. Studies have shown us that it's typically around 64 years of age, and about 60–65% happen to be males. And these are unexpected, sudden loss of consciousness, and by definition, they're clinically dead. Because when we look at that primary cardiac event in that age group, they have an electrical abnormal rhythm called ventricular fibrillation, and it's the AED's job to get them out of that rhythm. And without the AED, we really can't, increase the survival whatsoever.
I was going to ask, what is the survival rate without that intervention?
Without that intervention, nationally, our survival rate is somewhere between 5 and 8%. And that's unacceptable. We could do much better. And we're probably at 40% in Derry with our program and our Heartsafe Community initiative.
And so how much time, if I saw someone drop and they're unresponsive, how many minutes do I have before they die? Well, they're clinically dead, you said, but how much time, and then, the brain, they're going to have brain damage too, right?
Absolutely. So your brain's that one organ that requires a constant steady flow of oxygenated blood. Deprive your brain of blood, and we have certain brain damage and or brain death in as little as 4 to 6 minutes. CPR, and our goal behind teaching CPR in our classroom is to really maintain some level of blood flow to the brain to save the brain. We talk a lot about the AEDs, and the AED's job is to seek out that electrical rhythm that's causing the cardiac arrest and to actually reboot the heart. We really need to use them in unison. We need to have CPR, critically important to outcome, equally as important as the AED.
So as a bystander, if I'm not trained, is there anything I can do for that person who's gone into cardiac arrest?
First and foremost, if you witness someone that suddenly loses consciousness and they were to collapse, whether you're out around town, Shaw's, or at the supermarket, anywhere in town, or even at home, the first thing to do is really call 911. Make that call or send someone to call 911 and get emergency services activated as soon as possible. Part of our response plan for this out-of-hospital cardiac arrest is it will send a Derry police cruiser that may be in that district. They have AEDs in their cruisers. They may get to the scene prior to EMS.
Oh, okay.
We will send an engine with 3 and a paramedic unit with 2 providers. We send a lot of resources to manage these emergencies.
Well, for how important, this is someo's life.
This is absolutely someone's life.
There's no doubt that without the care immediately, that there's a good chance he's either going to be, statistics say, it may be a male, but that person would have some brain injury if they survive. And the chances aren't very good for him.
They are not very good if we don't. And that's why our program and our Heartsafe Community initiative is so important.
Right.
We worked on this initiative over 2 years, and we established some goals. And those goals were to start to train residents, businesses, organizations, CPR-AD.
So any organization or business in town that may want to have their staff trained, are they able to just give you a call and you would go on site to train them?
We occasionally go on site. We do offer the training the third Wednesday of each month at 6:30 to around 9:30 at the Hampstead Road Fire Station. That's where we typically do our classes.
Oh, great.
But I am open to assist organizations and businesses and some occasionally do on-site training as well. Whatever it takes. It's easy to move our equipment and to do a training program on site as it is doing at the Hampstead Road Fire Station.
Are there any businesses that seem that they would any business would benefit from having the knowledge on how to use the AED and the proper CPR best practices in place. But are there some businesses that seem a little bit more, would be more beneficial for them to be trained, maybe doctors' offices or larger companies that have a lot more employees?
I think anywhere that the public gathers, that we should have a public accessible AED, and that we should have enough community members trained in CPR to actually utilize those AEDs.
Right.
And when I say public access defibrillator, it should never be in a locked cabinet. It should be behind someone's desk. It should be out in the open that could be used by anyone. With your training, you could use an AED in any location here in Derry. You see it on the wall, you see it in a cabinet, you remove it, you're able to use it. That's our goal. It's not that business that's their AED, it's really a public accessible device.
Okay. So tell us what AED stands for.
AED is an automated external defibrillator.
Okay.
It is a small box that has a microprocessor that has the ability to interpret the patient's heart rhythm. The most common heart rhythm that we see in out-of-hospital cardiac arrest is a rhythm called ventricular fibrillation. About 85% of the time that occurs. And the job of this AED is to determine that underlying rhythm, ventricular fibrillation, for example, and it allow you, the AED operator, to discharge the electricity through the patient's heart in an attempt to stop that rhythm and restore normal perfusion and normal cardiac output back to the heart. And the patient literally having a return of pulses.
So the heart just goes a little haywire and needs just a little jolt to...
Well, it is an electrical abnormal rhythm that occurs. It typically occurs in the lower chambers called the ventricles. And when this occurs, it's very acute, it's very unexpected. It can occur in adults that have no past medical history and no prior signs and symptoms. It just happens.
Wow. So there's no warning that, oh, my chest has been hurting today. It just happens.
Occasionally, we'll see patients that may have had a cardiac history prior to. They may have actually had chest pain. That's not at all uncommon.
Okay.
The most common scenario is that there was a sudden, unexpected collapse.
Wow.
And then the AED and CPR is absolutely life-saving. And through our program, Sue, where we train folks to do CPR and use that AED, they can typically start AED within seconds. They can send someone to call 911, someone to bring the AED to the patient's side. They can start high-quality chest compressions. They can deploy that AED within maybe 2 minutes. And they give that patient the best possible opportunity at survival. Now think about my EMS staff responding from one of our fire stations.
I was just going to say, 2 minutes, that can be a few minutes before you get to my house, because I think it would probably take a good 5 minutes to
Our
get
average
up to Derry.
response time to 90% of Derry is about 5 minutes, just under 5 minutes. And then we have to get on scene. We have to bring in about 100 pounds of equipment. We have to get to the patient. We have to bare their chest. We're looking at 7 to 8 minutes before we initiate care. If I could train you to do CPR and you could deploy an AED, you will save that victim prior to our arrival. Then you'll give us a viable patient that we can transport for continued care. This is a community approach.
Right.
The emergency medical services provided by the Derry Fire Department and our community CPR citizen group that provides CPR, early recognition, early access to 911, and early defibrillation.
I bet when the paramedics get on site and they see that an AED has been deployed, that they're really encouraged that there's a chance that this life can be saved.
Absolutely.
So you really, we're helping the EMS personnel. What about liability though? Is there any reason that someone should be concerned about, well, what if I don't use it properly? Or what if the person still dies? Am I liable for that?
That's a very good question, and the answer to that is very simply no.
No, okay.
New Hampshire has great Good Samaritan laws, and when we developed the public access defibrillation legislation here in New Hampshire, they attached it to the Good Samaritan laws, and New Hampshire has great Good Samaritan laws. And in a nutshell, what this legislation, what this law says, that if you use an AED in an attempt to save someone's life, that you're not responsible for any civil liability whatsoever, as long as you didn't perform gross and wanton negligence. Here's my message. If you do the training, you perform your CPR and use the AED as you're trained to do so. I've never heard of a case where someone would be sued for attempting to save someone's life. And yes,
sounds silly.
It is silly. The truth is, not all patients are going to survive. That's a fact. We're giving them the best possible opportunity. And I will tell you, without the CPR and defibrillation, that's a patient that more than likely will not survive. Right. We're giving them that second opportunity. Train our citizens, have public access defibrillators, use our emergency medical services as a unit, the pre-hospital component with the lay rescuers and the defibrillators, and then the care provided at Parkland Medical Center through the New England Heart Institute is second to none. We have a great system here for cardiac emergencies in the greater Derry area.
I agree with you, and I've actually had the pleasure of taking one of your classes, and the AED is not as difficult as one may think to use. It really prompts you to go through every step in a very seemingly slow process, but that's comforting to know that the units actually can help assist you to use it properly and to not forget any steps. And can you just briefly talk about your classes and what you cover in them?
We bring folks together, again, the third Wednesday of each month at the Hampstead Road Fire Station. If you're interested in one of these classes, they can either call me or they can email me at the...
Why don't you give us your email and phone number?
My email is chuckhemian@derrynh.org.
And Hemian is spelled?
H-E-M-E-O-N.
Okay.
And my phone is 845-5438 here at the Derry Municipal Center. And I will connect you with Elena upstairs, who maintains that roster, and she puts the students together with an instructor when we offer that training. So
before we go into what you do in the class, for the training, can anyone attend? Is someone from Chester, maybe a student at Pinkerton? He's a student at Pinkerton, but he lives in Chester. Is he able to come to the class?
We try not to turn anybody away that wants training.
Okay.
You know, ideally, this is a program designed for the residents, the businesses, the organizations here in Derry. But we make it a point not to turn people away. If people come in and they need CPR training, we're more than happy to help them. If they're a Pinkerton student living in Chester, I would not have an issue with that.
Okay.
I wouldn't allow them to take a spot from a Derry citizen. However, I would certainly help out anyone that wants that training.
So the age that you would recommend, what's the youngest that you think?
Well, I look at it this way. If they have the capability of compressing the chest, which means pressing the chest down approximately 2 inches, and that could be a 10-year-old, that may be a 13-year-old. If they're able to compress the chest, I'm more than happy to train them. And even younger children, we can at least instruct them on how to access the 911 system, what to say, what to do, and how to respond to an emergency. So I think this has broad application for all age groups, from the very young to the very old.
Right, great. Okay, so go into explaining what your class covers.
Well, we do our American Heart Association Heartsafe CPR AED certification class, and you actually leave with a certification card with an expiration date of about 24 months, 2-year card. And we train them in Heartsafe CPR for an adult, single rescuer as well as 2 rescuer. We teach them how to use barrier devices, which are the breathing masks to deliver rescue breaths without the fear of communicable disease transmission. We teach them how to clear a foreign body airway obstruction in an adult and child. And we, most importantly, run through the AED. And then we do a lot of hands-on practice doing CPR, managing the airway, and deploying the AED. And with 2 or 3 providers, and give the people the opportunity to practice, and really to develop a style that's skilled, that allows them to compress the chest at 2 inches, have good communication amongst the team members and other folks, and most importantly, deploy that so important AED.
I think by taking the class, I found that it gave me confidence, and also brought me up to date as what the best practices for CPR are, because it's been a while since I had been certified. So it was very informative. You're a wonderful teacher. There was no written test at the end, if that encourages our viewers.
No written tests.
And it's really quite simple, the steps. It's not like you have to remember these 10 steps. It's just a few things, which some of them would just come naturally, to know to call 911. And so in that, I think it's very worthwhile, and especially since you offer the classes free.
This is a life skill that everyone should have. At some point in your life, you're going to have a friend, a loved one appear that somebody's going to have in a medical emergency that's going to require you to be that good Samaritan, that lay rescue that's going to have to act. You're going to be in that position at some point. We want to offer you that training to be prepared.
Well, it's, and the other thing I really picked up was to just remind us that the CPR is saving our brain.
Correct.
And that the AED is what is rebooting the heart. So we really need to have those 2 skills together, and that you offer them in the class is wonderful. Is there anything else that we may have missed that you feel like we should cover today?
Well, in the absence of having an AED, let me tell you how important the CPR is. We know that you have a very short window of opportunity at survival, and it's literally 4 to 6 minutes before you have certain brain damage. However, high-quality CPR will buy you a window of opportunity until that AED arrives. So if we're at a residence, you're at home, and there's a cardiac emergency, and you call 911, and if you're doing really good CPR, high-quality CPR, and we're minutes away, you're still giving that patient the best possible opportunity. And we encourage people to, do the CPR as best they possibly can, call emergency services via 911, and we'll be there as quick as possible, and we'll engage that patient. In the absence of doing CPR, and it's not uncommon that we'll arrive and there's no CPR in progress, people may not feel trained, they may not have been able to recognize the cardiac arrest. Those are the patients and victims that don't have good outcomes. But we find that if, in the absence of having that public accessible defibrillator, the high quality CPR is still critical to that outcome.
And that CPR is so much easier today than it was 10 years ago.
My goal has always been as an instructor to make this as simple and as easy to remember. I recognize that 97% of the people I train will never use this skill. So I really need to teach you a skill that that you'll probably never use, and that's a fact, and that's probably a good thing, Sue. But nonetheless, I want you to be prepared if there was a medical emergency in the future and you needed to act. I do a lot of training. I'm very repetitive in my teaching style. I mention things several times in different ways, and I really push people to practice, get it into long-term memory. Should there be an emergency, your adrenaline is flowing, you're going to be able to perform CPR to the next level and give that individual the best possible outcome. And in the end, you're going to feel like you did everything humanly possible to save them.
Right, so you can feel
and
good
that's so
about
important.
that.
Yes, absolutely.
And with the classes being free and every 3rd Wednesday of the month, it's kind of nice to know that, well, if I'm not feeling as confident as I was 6 months ago, let me just go in for a refresher class.
Of course.
That I can do it 2 or 3 times over the process of a couple of years, and then really have the confidence to know that if something happens.
Absolutely.
So that's wonderful. I really thank you for what you're doing for our community, what you're offering them.
I'm passionate about it. I'm passionate about Derry, and my goal is to ensure that we have a heart-safe community to the level that this is something that we're going to have a 50–60% survival rate on.
Right. On our second part of the show, we're going to be meeting with Jamie Boudreau, athletic trainer at Pinkerton Academy. He's had the opportunity to actually use an AED that saved the life of a community resident. I'm here at Pinkerton Academy. Pinkerton is a Heartsafe community participating in Derry's program. I'm with Jamie Boudreau, the athletic trainer here at the school. Jamie, how many AEDs do you have here on campus?
I don't know the exact number, but I believe there's 10 or 11 on campus. Just about every building that we have has one. Not only are they in the buildings, but my colleague and I both have mobile ones that we carry with us, when we're out at games or practices or such. So each of us have one that's mobile that stays in our bag. And then I believe there's 10, 11, again, I don't know the exact number, but just about every building has one.
Do you know how often they have been used?
Recently, it seems like they've been used certainly more than than they have, but I think 3 times. I think on campus 3 times in the last, I'd say the last year or so. So yeah, something in that neighborhood.
So that's quite often, in my mind, to have to use 3 AD units and perform CPR within the last few months. So that shows certainly a need for the use of people being certified in CPR and AED. How long have you been certified?
I've been certified in CPR and AED for, well, I've been doing this job 18 years now, so roughly that long. 18 years. I can't, it's hard. I can't remember exactly when AEDs kind of came into, mainstream use, but it's certainly been a while.
So I understand you've actually had to use one of the units this past fall. Can you talk about how that transpired?
Sure. This past fall, we had a football game against Keene High School on a Friday night. Just prior to kickoff, one of our chain crew members came running over to our sideline, which is where I happen to be, and made the comment that somebody on their sideline had collapsed. And as I was making my way over there, I could hear some other people saying, we need help, we need help. So I'd gotten over there, and there was an elderly gentleman who was unresponsive. He'd had what was called, American Heart calls them agonal respirations. It's not really breathing. They don't consider it breathing. It sounds like he's gasping for air. Luckily, the AED, my athletic director was kind of Johnny on the spot and brought the AED over. There was a woman there who to this day, I still don't know who she was. I think she was a fan on their side that started doing chest compressions. I kind of proceeded to cut off his shirt, place the AED on him, and delivered a shock. And our EMS crew was there in record time. They were there very, very quick, and they kind of took over from there. And I think what makes this story a good story is obviously that the gentleman survived, and so I had a good outcome.
That's wonderful. So is there a program here at Pinkerton an initiative to get more people certified?
I think there is. Just this last week, there were some workshops that teachers took part in to get CPR and AED certified. I believe it was run by our nursing staff. I think they taught that class, but I think there's going to be more of that going forward. I would certainly like to see everybody, if at all possible, become CPR and AED certified. And again, my colleague and I teach it to our coaches because they have to get certified. It's mandatory that they get certified, and we a lot of times we'll often tell them, it might not be your athlete, but you could be at a family picnic, and Uncle Bob, happens to go down, and if you know what to do, you could certainly save his life. So.
And so is there an initiative also to involve the students and get maybe the students more involved in health class? To me, that makes sense that they would teach that in health class or in some of their curriculum.
Certainly. I know, I believe the HST students get certified in that. I know my colleague teaches a athletic training class. She teaches an athletic training class, and through that athletic training class, she certifies those students as well. So I don't know exactly where the school is in that process going forward, but again, certainly the more people that are certified and know how to use an AED and are certainly not afraid to use it, it is beneficial for everybody.
I hope you've learned a lot about the CPR and AED use in the classes that Chuck offers. I really encourage you to take them. They're easy classes, very comfortable, no written test at the end, and it really is a valuable life skill to have. Once again, my name is Suzanne Bernier Robinson. Thank you for watching Get the Facts.